She's fierce, she's loving, she's a boss, she's giving sisterhood, support and service. Mocha Mom. She's fierce, she's loving, she's a boss, she's giving sisterhood, support and service. Mocha Mom. She is, yeah. She is Mocha Mom. She is, she is Mocha Moms.
Good evening, Mochas and supporters of Mocha Moms Incorporated. Thank you all for joining us this evening. And now, will you please allow me to introduce our distinguished National Board? Okay, I thought the slide was going to come up. I thought we have a beautiful picture of our board, but I don't see that slide, but we're going to keep going. So we have our president, our national president, who is Quay Couch. We have our founder, Shelley English Figaro. We have our vice president of operations, LaShawn Martin. We have our wonderful treasurer, Kim Scott. We have our national director of partnerships, Shalon Newton. We have our director of advocacy, Danae Eicher. And I am Cassandra Johnson, your National Director of Community Service and Engagement. This evening, we have Understanding Your Family's Health, History, and Heritage. This program is being brought to you by Mocha Moms Incorporated in partnership with the All of Us Research Program. The future of health begins with you. Ladies and gentlemen, we are honored to have Dr. Altovise Ewing, is a clinical scientist with 15 years of genetic counseling, health disparities research, and health equity strategy experience. She earned a PhD in genetics and human genetics with a specialization in genetic counseling from the Howard University, and completed a Cancer Health Disparities postdoctoral research fellowship at Johns Hopkins University School of Public Health. Dr. Ewing has dedicated her career to ensuring that emerging genetic, genomic resources, services, and technologies do not further exacerbate racial and ethnic health disparities and inequities. Her unwavering passion for health equity and inclusion have afforded opportunities for her to engage with a myriad of stakeholders across genetics and genomics ecosystems. She serves as a trusted and committed healthcare liaison to marginalized, medically underserved, and underrepresented communities, participating in research and accessing genomic services. The next voice you will hear will be that of Dr. Ewing. So let's talk about health.
Thank you so much, Cassandra, for that warm welcome and introduction. I really appreciate it. Well, hello, everyone. It truly is my honor and a pleasure to be here this evening to share some information with you about understanding your family health history and heritage. So just to quickly share an agenda of what I will cover this evening, I will provide a few objectives for you for this evening. I also will take the time to introduce myself, share a little bit more about my story as a Mocha Mom. I will introduce you to the All of Us Research Program, share some information with you about genetic counseling, I will also provide details on how you can join and get involved in the All of Us research program, as well as the types of results that you may receive if you do decide to participate. And then lastly, end with some supporting resources for participants. For this evening's objectives, I aim to educate individuals about the role of a genetic counselor, and specifically within the context of the All of Us research program. I will orient you to the All of Us research program and the research participant experience. And then lastly, introduce you to the All of Us research, the test results and registration options that are available. So just to provide a little bit more information about myself. So on this screen, you will see a picture of what I now call my heartbeat. So this is my daughter. Her name is Anna Adora. And she is 6.5 months. So this has been my introduction, my foray into motherhood, and it has definitely been an enjoyable ride. I always say it's exhausting and exhilarating, but I wouldn't trade it for the world. And also to connect her name to our topic this evening, especially when it comes to heritage. So Anna is actually my maternal grandmother's name. And growing up, I really considered myself a grandma's girl. So it was very important for me to be able to really pass that name on to my daughter. And then Adora, as her name is hyphenated, it actually means daughter of the people. And then her name is spelled Adaora, and the prefix Ada actually means first daughter, which is something that I learned after she was born. So someone who's very near and dear to my heart was kind enough to share that with me. But just wanted to share my heartbeat with you all this evening, and just share my excitement in really presenting to this audience this evening. So let's jump into it and learn about the All of Us research program. So the All of Us research program is a federally funded research program that has a simple mission, and the program really aims to speed up health research. And it aims to do so by creating one of the largest health databases that has ever existed. The program is also very ambitious in that it aims to recruit at least 1 million individuals of diverse backgrounds. And the program really wants to recruit a participant base that is reflective of the society in which we live. So the program is all about ensuring that individuals from underrepresented backgrounds, walks of life are included in the program. All of Us has done a phenomenal job of really partnering with many organizations across various regions, medical centers, healthcare provider organizations, federally qualified health centers, the U.S. Department of Veteran Affairs, and community organizations. And this was very important because all of us realized that it could not go out and recruit alone, but instead it had to partner with the trusted liaisons and the trusted messengers and trusted partners of the communities in order to really engage a diverse participant cohort. So this is a slide that I will actually come back to again at the end of the presentation. But if individuals are interested in checking this out now, you can get involved in the All of Us program by joining, and you can go to participant.joinallofus.org. And there you will be walked through the steps to create an account, to give your consent or permission to engage in the research study. And then as you'll see, there are subsequent steps to get involved in the program as well, including sharing your electronic health records, signing a consent form to get your DNA results, answering a multitude of health survey questions that are sent out periodically to participants, as well as having measurements taken, such as various biometrics, your height, your weight, blood pressure, etc., in addition to providing a biological sample in the form of blood, urine, or possibly even saliva. So here I will provide a little bit of information about the field of genetic counseling. But before doing so, just wanted to kind of level set just to make sure that we are aware of the difference between genetics and genomics. So as you'll see on the screen here, there are two images. One is a picture where the person highlighted in color is number 22 on the field. So there's one person that is highlighted in color. So that is the person who your eyes should be drawn to at this time. And this image is reflective of the field of genetics. And genetics is a field where we are studying the passage of genes, or how genes are passed down through a family from person to person. When we study genetics, researchers are oftentimes looking at a limited number of genes. They may look at one gene at a time or multiple genes at one time. And as I mentioned, this image where one player is highlighted on the field is reflective of the field of genetics. So you can think of it as studying one player on the field at one time. Whereas the field of genomics, as you can see the image on the right of the screen, we can see all of the players. We can even see the fans in the background, and we can see the field. So here we're studying a multitude of players, multiple genes, and we are also studying those genes, the interaction of those genes within a particular environment. So this gives us some insight into risk for disease, as well as risk for conditions that could be hereditary, running in the family, or even conditions that certain populations may be at increased risk of. So what is a genetic counselor? Genetic counselors are healthcare providers who really translate complex genetic information into simplistic concepts in language that anyone can understand. We are individuals who are really here to empower patients, empower research participants to make informed decisions about their health or even about their research experience. If you've ever interacted with a genetic counselor before, it may have been in a prenatal setting, a pediatric setting, a cancer center setting, etc. But genetic counselors come in a variety, or have a variety of different backgrounds and specialties. And some genetic counselors may meet with patients or research participants in an in-person setting, whereas others may actually leverage a telehealth option. And that has become a lot more common, especially once the pandemic commenced. You may find that genetic counselors work in a variety of different settings, including research, education, industry, marketing, and many other roles. Genetic counselors may meet with patients or research participant in a one-on-one capacity, or they may meet with an entire family. So it really just depends on the preference of the patient or research participant. And they may also meet with individuals before genetic testing is offered, around the time that testing is offered, or even afterwards to discuss those test results. And as I mentioned, genetic counselors are healthcare providers who are truly here to empower patients and participants to make the best informed decisions for themselves and their families. Genetic counselors are not coercive at all. We are really not directive in that we are going to tell you what to do, but instead we will provide you and equip you with all of the information that is necessary for you to make a decision. And then lastly, if a patient or participant does decide to go through with genetic testing, then genetic counselors will help you decide which tests to pursue. So let's talk a little bit about, if you were to meet with a genetic counselor, what type of information you may share. So one, we'll start with your personal health history. So this personal health history information is oftentimes characterized by your medical and surgical history. So depending on why you may meet with a genetic counselor, it may be very important for us to understand if you've had any surgeries performed in the past to help reduce your risk for various conditions. It's also important to have an idea of what types of conditions you may have been diagnosed with in the past, or even at increased risk of. Adoption status is also key to disclose, as knowing if one has or has not been adopted can help us navigate the genetic counseling process and make that process very tailored for individuals. It's also important to know if you have a history of genetic testing. Oftentimes, we may find that there are patients or even research participants who have undergone genetic testing in the past. And it's possible that that person may be eligible for update testing or additional testing, as the field of genetics is constantly evolving and new advancements are always coming out at an accelerated pace. So we always want to make sure that someone has had the most up-to-date and recent test that is available to them. In the case of cancer genetic counseling, it's very important to know your personal cancer history and to share that with your genetic counselor. And also, if you know your genetic ancestry and ethnicity, that information can also be very informative in terms of giving us an idea if there are certain conditions that certain populations may be at increased risk for based on genetics, based on population migrations, and even gene pools. When you meet with a genetic counselor, you will also discuss your family health history. Oftentimes, a genetic counselor will collect at a minimum a 3-generation pedigree. So that will include information about yourself, your generation, if you have children, their generation, if your parents' generation, your grandparents' generation, and possibly even your great-grandparents' generation. So that's typically at a minimum, but the more information that you can provide, the better. And it is very important to be able to provide information not only about one side of the family, but about both. So if you have that maternal health history as well as the paternal health history, it's really going to increase our ability to make sure that we're identifying the most accurate and precise risk for various conditions and navigating the testing options in an appropriate manner. However, if someone does not know both sides of their family health history, that does not prevent them from meeting with a genetic counselor, and it does not necessarily prevent you from being able to pursue genetic testing in the future either. So just wanted to make sure that I was very clear on that. Also, the family structure will be very key to talk about. So discussing those relatives who are still living, as well as those relatives who may have died, as well as discussing the size of your family. At times, we may find that we may get a little less information from individuals who come from smaller families. And this information could at times limit our ability to offer certain genetic testing options to various patients or participants, but that's why it's very important for us to really discuss that family structure. Again, it's key to share information about the medical and surgical history of various family members and even why they may have had certain surgeries in the past. If there is a history of cancer, it's important to know the types of cancers that individuals were diagnosed with, as well as the age at which people were diagnosed. And then in the case that there might be rare cancers that are diagnosed in the family, that could be what we call one of the cardinal signs, or a red, one of the cardinal signs that perhaps the cancer that is present in the family might be attributed to a gene variant or a gene mutation that has been passed down from generation to generation. Discussing the history of genetic testing in the family, as well as the combination of certain cancers that might exist within the family, will also be important to discuss. Within the context of the All of Us research program, if someone does opt into the program and undergo genetic testing and get your DNA results, you will meet with a genetic counselor, and that opportunity to meet with a counselor could be in a one-on-one capacity, or you have the option to bring your family members along as well. But you would be responsible for really either calling your relatives to allow them to access that session via phone, or if you choose to engage in a virtual platform, you would be responsible for making sure that they're able to get connected as well. But oftentimes the genetic counseling appointments are done over the phone. They are free to all research participants in the All of Us research program, and they're confidential. You can also request to speak with a genetic counselor who speaks Spanish. And then the All of Us research program has been very diligent about making sure that the documents that are included within the program are interpreted and can be interpreted in multiple languages. Here I wanted to provide a few more resources about genetic counseling and how you can get in touch with a genetic counselor in the All of Us research program. So All of Us research genetic counselors, again, can provide genetic counseling services over the phone, and it's free, no charge to participants. And you also have the option to invite your healthcare provider or your clinician to join that appointment as well. Here you'll see the phone number that you can dial for clinicians to join the All of Us research genetic counseling sessions with their patients. And then participants, as I mentioned, can ask to speak to a genetic counselor who speaks Spanish. And then if individuals have questions for the genetic counselors, they are always encouraged to reach out to that genetic counseling phone number. In there, genetic counselors can talk to research participants about the results that they have received, explain the limitations of the genetic test results and how those genetic testing results might differ from from a test result that perhaps someone's healthcare provider has ordered in a clinical capacity. The All of Us research genetic counselors will also guide participants on accessible opportunities for follow-up care. So although you might be participating in the All of Us research program and doing so in a research capacity, there might be the need or recommendation to pursue additional testing in the capacity of your medical care and medical management. And that genetic counselor can walk you through those steps in that process. And that may be the case for individuals who decide to get their DNA test results. And if they do get a result where a variant is detected, or also known as a mutation, then it might be possible for that person to be recommended for confirmatory testing. And again, that genetic counselor can walk individuals through that process. And lastly, genetic counselors are here to discuss the scientific and medical information with individuals, but also here to acknowledge, discuss, and support participants in talking about anything that is important to them. So as genetic counselors, we do tend to the psychosocial needs, concerns, and cultural beliefs of all of our participants and patients. So what is genetic testing? Genetic testing is a medical test that healthcare providers can use to screen individuals for a particular health condition. And at times, genetic tests can be used to actually diagnose individuals with conditions. These tests also give us an idea of the possibility that there are certain genes or gene variants that are being passed down from generation to generation. So from mom to child or dad to child. And most of the time when we talk about genetic testing, it's done in a clinical capacity or in a clinical setting. However, in this case, within the context of All of Us research program, genetic testing can be done in a research space, research setting. So what is a gene variant? And I know that you've heard me say that several times this evening. Previously, we actually referred to variants as mutations, but as our knowledge evolves and as we learn more, the language and vernacular that we use within the genetic space will change as well. So we now call changes that we see in the DNA variants. And honestly, genetic variants they're simply those differences that we see in our DNA. Everyone has genetic variants, and oftentimes those variants are what make us unique. It's what makes you you, it's what makes me. Most variants are harmless, and they can change the way that we look. They can also impact other characteristics, such as whether or not we can taste certain foods and how those foods may resonate with us. And then some genetic variants actually have no effect on us at all. And then at times there might even be genetic variants that could decrease our risk or lower our risk for various conditions. And although most of the time we talk about genetic variants within the capacity of them being harmful or what we call pathogenic, these are the variants that are oftentimes associated with increased risk for various conditions such as cancer or even heart conditions. But if you are found to have a pathogenic genetic variant in the All of Us research program, that's where that genetic counselor can meet with you, meet with you and your family, or meet with you, your family, and or clinician to really discuss the meaning of that result, as well as the next steps that are recommended, which might include that confirmatory testing. So how do we analyze your DNA within the context of All of Us research program? So there are two methods that the All of Us research program uses, and those methods are genotyping and whole genome sequencing. So genotyping is when we look at a small amount of DNA that gives us information about many of the common DNA changes among us. So you can think of genotyping as looking at maybe just the letter E within the paragraph or within the sentence, genotyping looks at a small amount of DNA that gives us information about many of the common DNA changes among us. So looking one letter at a time or looking at one specific letter is what we would call genotyping. Whereas whole genome sequencing is where we are looking at the genome in its entirety. So we're looking at the whole genome, or at least the majority of the genome, to determine if there are any genetic variants. Again, benign, harmless, or pathogenic, meaning those that are associated with increased risk for various conditions. Clinical genetic testing. So if hereditary disease risk results, which is one of the results that can be offered through the All of Us Research participant experience, if someone's result shows that someone has an increased risk for a serious condition, then All of Us Research actually offers clinical DNA testing to research participants at no additional cost. And that is done through Color Health, which is also the company that offers the clinical genetic counseling service as well. So for the hereditary disease risk result, and again, I do have another slide that covers this again in the future, this particular test looks at 59 genes that are associated with various hereditary diseases, and it's looking to see if there are any changes in those 59 genes that we know are associated with an increased risk for the diseases of study. So during a participant's hereditary disease risk All of Us genetic counseling appointment, again, that genetic counselor will talk to you to make sure that you fully understand your test result, the benefits and limitations of clinical genetic testing, including the types of results that you can receive. So that conversation will be very in-depth and thorough prior to you deciding to go through with the testing. The genetic counselor can also order the clinical DNA test kit through Color Health, as well as recognize other ways for you to get clinical confirmation DNA testing if it is preferred. So what type of information can individuals receive through the All of Us Research participant experience? So as I mentioned earlier in the presentation, individuals are asked to provide a biologic specimen in the form of blood or saliva in order for their DNA analysis to be performed. And once that blood or saliva is provided, there are two different health-related DNA results that individuals could receive. Both health-related DNA results are based on whole genome sequencing. So the types of results that you could receive once your DNA is analyzed include a genetic ancestry result. So this could give some insight into where your family may have lived hundreds of years ago or where your family may have originated. You will also get information about genetic traits. So this is that fun and interesting information that gives us some insight into who we are and the unique characteristics about ourselves. You will also receive results around medicine and your DNA. So this gives some insight into how your body might respond or react to certain medications. Are you likely to be able to break down a medication a little bit quicker than most, or maybe you're slow to metabolize certain medications? So that medicine in your DNA result can reveal that information. And then lastly, the hereditary disease risk information can provide insight into whether or not you have an increased risk of developing a certain health condition such as cancer or heart disease. Genetic ancestry and traits result. As I mentioned, your genetic ancestry result can give some information around where on the globe your participants may have lived hundreds of years ago. And then that traits information, again, provides that fun info. Are you likely to have wet or dry earwax? Are you lactose intolerant? And then what is your preference for cilantro? Does it taste like soap? Or can you not taste it at all? Again, the medicine and your DNA results, it looks specifically at 7 genes that we know are associated with the ability to metabolize certain medications. So this is one of the results that can be provided to individuals. And then again, the hereditary disease risk results, which looks at 59 genes. And these are genes that when we see pathogenic variants within those genes, we oftentimes associate them with an increased risk for different forms of cancer or even heart disease. So those are the main ones that are considered on this panel. And will my DNA results affect my children? So if you do have children, as an individual, you pass on at least half of your DNA to your offspring. And because DNA is passed from biological parent to kids, this information could be very important for your children, but also for other family members and relatives as well. So you will be able to choose if you want to see your DNA results. And then you also have the option to share that result with your family member. And as I mentioned previously, if you do decide to go through with the genetic counseling service, you have the ability to invite your family members to join you in that conversation. If there are certain conditions that you are concerned about as you undergo the All of Us research experience, then that is information that you are encouraged to share. And even when it comes to your own medical management, as genetic counselors, we're always empowering and encouraging individuals to really bring to the table anything that is of concern to them. Nothing is off the table to discuss it, especially when it comes to managing your health and managing your risk for various conditions. And then if individuals do need help really understanding their genetic test results, then a genetic counselor can definitely be the person to interpret that test result to them. And if that genetic counselor with whom you initially connect is unable to provide the service, possibly because of the state in which they live, then that genetic counselor can definitely get you in touch with a genetic counselor who is eligible to provide the service to you based on federal or even state licensure laws or even requirements. Again, if you are interested in joining the All of Us research program, you can go to participant.joinallofus.org. And there you will see a series of different steps on how to create an account, how to give your consent to participate in the program. There's also a module on sharing your electronic health records. You do have the option to share some records as opposed to sharing all of your records, but All of Us does a great job of really giving participants the autonomy and agency in determining what results they want to share. You would also consent to get your DNA results. Again, that is contingent upon you providing a sample, a saliva, blood, or urine sample that could be tested. And as I mentioned, you will receive surveys periodically throughout the All of Us research experience. And then again, All of Us is not just about providing individuals information about their genetics results, but also really collecting those other metrics that could give us some insight into risk for various conditions. So the All of Us research program is really a phenomenal approach to collecting genetic information, environmental information, behavioral information, and bringing it all together to be able to provide each participant with the most tailored and precise, individualized information that it can about someone's health and how to manage their health moving forward. So where can All of Us research participants go for help? So one, you can go to your healthcare provider for information. So healthcare providers typically provide medical advice and recommendations. This may be around the appropriate screen to pursue, or even coming up with a prevention plan that is specific to a particular patient. Healthcare providers oftentimes make recommendations for prescribing specific medications or even dose adjusting. Healthcare providers can refer individuals to specific local providers based on medical insurance plan coverage and even knowledge of providers in their particular area. A healthcare provider can integrate someone's DNA results into the electronic health record and can also order clinical confirmatory testing through an outside genetic lab. And if that testing is ordered through an outside lab, it could have associated costs. So just so that individuals are aware, a healthcare provider can definitely be a partner in really helping to navigate someone's All of Us research participant experience. And again, the All of Us genetic counselor is here and is available to help guide participants along the next steps based on their DNA results. And this is also going to be based on established and current clinical guidelines that are available. The genetic counselor discusses how one's medicine and your DNA result may affect certain prescription medications and how to talk to providers about the usefulness of really confirming that result. And if someone does get a result within their medicine and DNA result that indicates that they are slow to metabolize or quick to metabolize a particular medication, it's recommended that individuals talk to their healthcare provider about that result before taking any action, because the healthcare provider is going to be the best person to partner with to really ensure that the decisions moving forward or even the management strategies moving forward are what's best for you at that time. The genetic counselor will provide guidance for identifying the types of providers or even specialists that one may need to consider seeing based on your results. Genetic counselors can guide participants on how to discuss DNA results with providers and family members. Again, that genetic counseling session, it can be a family affair. You can invite the entire family and your healthcare provider to that session. And I always say that family health history should not be a mystery. So in the event that we do know information about our family health history and we can share that information, it's highly encouraged that we do, because it could truly make a difference in the ability to prevent the onset of certain disease in certain family members, and really give them the best chance of really managing any increased risk that they may have for a particular condition. And then lastly, as I mentioned, genetic counselors can help facilitate that free confirmatory clinical DNA testing option for participants who are found to have an actionable result or a variant detected in their All of Us research program experience. So if you do have additional questions about the All of Us research program, this is a link that you can check out, joinallofus.org /what-participants-receive. And then also here is a QR code specific to MoCA moms, where we do encourage you to scan the QR code that's on the screen. This will help us identify those individuals who were directed to the All of Us research program through tonight's programming and through the MoCA Moms partnership. If you have additional questions about the All of Us research program and specifically about genetic counseling, there is a genetic counseling resource call center, and that number is available on the phone. And then if you have a preference to reach out to the program via email, you can email help@joinallofus.org. And then for extensive and comprehensive information about the program, the joinallofus.org link is going to be the best one to consider. Great. And I think we're right at 8:40. So now I know that there were several great questions that came through before our session kicked off this evening. So Cassandra, definitely eager to get the conversation started.
Yes. Oh my gosh. First, we want to say thank you so much. That was wonderful. I think you provided so much information, and we see people joining from coast to coast. I see from New York to California down to Georgia on the line. So thank you, MoCAs and friends of MoCA Moms, for joining. One of the best things that I felt like I heard that you said this evening was family health history should not be a mystery, and our health definitely matters. So the first question that we have, are there genetic tests that I can ask for that can detect a gene for dementia?
Really great question. So dementia is really it's a catch-all phrase that is oftentimes used, but oftentimes when people use the term dementia, Alzheimer's might come to mind, or even other conditions where there is memory loss associated may come to mind. And for certain conditions, there are genetic tests available. While those types of conditions are really going to be a result of a combination of genes and possibly even environment, we have been able to identify some genes and some genetic variants that are associated with increased risk for conditions such as Alzheimer's. So really having that conversation with your healthcare provider or with a genetic counselor is going to be the best route to go, because one, they would be able to tell you about the tests that are available, and even if you might be the best person in the family to test, or if there might be another family member who's more appropriate to test, and that could be more informative for the family.
Okay. The next question that we have is, do you recommend that we use ancestry.com to find out our heritage if we are unaware of where our ancestors originated from?
So while I will not necessarily endorse one particular company or one particular test, I can say that, the testing companies such as Ancestry, 23andMe, African Ancestry, they all offer different products. So I really encourage individuals to take a deep dive at the different products. Some of them may provide information about ancestry or heritage alone. Others may provide information about ancestry and health. And then others may provide information about where your ancestors originated within various countries on the continent of Africa, and even certain tribes. So it really depends on your preference for the type of information that you're seeking, and if that preference really aligns with the product offering of the unique company. So that answer would really differ for different people depending on what you're looking for.
Okay, I know the answer to this question, but I think they want to hear it from you. What is the cost of the test? How much does it cost for us to be a part of the All of Us research program?
Yeah, so it is no cost, no charge at all for individuals to participate in the All of Us research program. And if you do undergo genetic testing through the All of Us research program, that would be covered. The only time that a cost could be incurred is if there is a need to undergo additional testing. And if you decide to pursue that additional testing, perhaps in the capacity or through the capacity of your insurance, or even seeking a healthcare provider who is not affiliated or working through the All of Us research program. But to participate in the program, it's absolutely no charge at all to participants.
Thank you. Next question. Does the testing detect breast cancer heredity without the BRCA gene?
So the All of Us research program genetic test, so it looks at the particular test that could give some insight into one's risk for breast cancer. That test looks at 59 genes total. Some of those genes are associated with breast cancer. Some are associated with other cancers. And then there are a few genes associated with heart disease included. You specifically asked about the BRCA2 gene. That is just one gene that we know is associated with breast cancer. So it is always possible that someone could have a variant detected in another gene that we know is associated with breast cancer. So just everyone inherits the BRCA1 and BRCA2 gene. You get them from both mom and from dad. So it's important to understand, that risk for being a carrier of those particular gene variants on both sides of the family. But it's also very important to know that BRCA1 and BRCA2 are not the only genes that we know are associated with breast cancer.
Definitely. Thank you. Next question. How do we pass down traditions and heritages without passing down the trauma and the triggers?
Yeah, so great question. And this is where I will definitely say and highly recommend connecting with a counselor I think counselors are going to be the healthcare providers who are best equipped to share best practices and even current guidelines in terms of how we can cope with certain experiences that we have experienced or encountered in life, or even family members. And those counselors can provide us with the tools to really help us navigate those circumstances. So while that's not necessarily within the scope of my practice, I see a counselor regularly. I see a counselor on an individual basis. I see a counselor for my family dynamics as well. So I definitely believe in counseling and believe counselors are the best healthcare providers to really educate and inform us on how to really continue to pass on the things that are important to us in terms of heritage and traditions, while also trying to navigate away from those things that are traumatic in our lives and can trigger us to a particular state.
Okay, wonderful. So this is a two-part question. One is in situations where information of medical history for a person's paternal side is not available, how useful is genetic counseling? And then also thinking about those who have been adopted,
Mhm.
and what are their options on finding out, like getting their genetic testing?
Yeah.
So if you could.
So I'll start with the latter part of the question first. So in the event that someone is adopted, that does not necessarily preclude or prevent you from being eligible from accessing genetic testing. That's where your personal health history will be immensely informative in determining if you are a candidate for genetic testing moving forward. So let's say you are adopted and your maternal and paternal family health history will not necessarily inform your eligibility. But let's say you have a personal history of cancer, and let's say you were diagnosed perhaps with a rare cancer or diagnosed at a really early stage with cancer, or perhaps you have symptoms that are associated with an increased risk of cancer. This is the type of information that could render you eligible for genetic testing, despite the fact that your family health history would not necessarily be applicable in that case. And then the first part of your question was if someone does not have information about the paternal side of their family, would they still be eligible for genetic testing? In some cases, yes, that is very possible. Again, that's where the combination of your personal health history combined with your maternal health history would all be taken into consideration to determine your eligibility for testing. And then also, if I can just take a moment just to share a little bit more about my personal story here. So I trained at Howard University in the genetic counseling program. And while I was enrolled in a master's level program at the time, during my clinical and specifically my cancer genetic counseling rotation, I saw so many young women who looked like me, who had personal histories of cancer, but at the time they were not able to provide sufficient family health history that would really render them eligible for genetic testing. So I just saw so many young women, again, with that personal history of cancer, who were being denied genetic testing because at that time they did not meet the guidelines. And for me, that was deeply disturbing because I really saw genetics and genetic testing as an opportunity to help really eliminate disparities and foster health equity. Because if people underwent genetic testing, we could possibly identify if there was a change in their DNA that caused their cancer or put them at increased risk. But to see that there were so many young women who looked like me, again, who had that personal history of cancer, but were denied that opportunity, I really wanted to find out why that was the case. And what I learned was that the guidelines that we were following at the time to determine if someone was eligible, a lot of those guidelines were based and were rooted in data for people of European descent, of European ancestry. So the guidelines were established for everyone. The guidelines were used to determine if anyone is eligible for testing, but really the data that went into informing the established guidelines, those data were not representative. Those data were not reflective really of the young women who were being diagnosed at much younger stages and at much younger ages with cancer, but at more advanced stages. So that is what really motivated and prompted me to pursue my PhD in genetics and in genetic counseling, because I really wanted to be able to ask those questions that were not being asked, and be able to arrive at the reasoning in terms of why do we see that these guidelines are constantly being established and generated, but the data used to inform those guidelines are not representative and reflective. So just wanted to share that, because it really took me back to the time where I was in clinic and I saw that limited information that was being shared with a genetic counselor. And I saw how that did really cause some people or prevented some people from being able to access genetic testing, but really knowing that scientific inquiry could change that. And by asking the right questions, we could change the guidelines and collect the data that's needed to really broaden that access for more people.
Oh, absolutely. Totally agree with that. Another question that we had was new research is coming out about APOL1 gene and its impact on kidney disease with people of color. What is your experience with this type of research, if any, if you have any experience?
Yeah, that's a really good question, and it is something that I have learned about recently. But I can share that that's not an area of research that I have been focused in or involved in to date. But given the recent finding around APOL1, and also knowing that that kidney disease is a condition that disproportionately impacts people of color, that is an area where I encourage people to talk to their family members, talk to their relatives about the presence of kidney disease. Find out if anyone has been tested in the family, either in that research setting, research capacity, or if a healthcare provider has ordered testing for them. And also ask your healthcare provider if you or a family member might be an appropriate candidate to consider testing for APOL1. But to date, it's not an active area of research of mine.
Okay. Another question is, why do Black people have more problems with medical issues like high blood pressure, diabetes, cancer, etc., than other ethnic groups? At least it's perceived that way.
Really good question. And I really like just how this is a question where we have to think about, there could be genes that are increasing our risk for these various conditions. But we also know that there are environmental factors, there are behavioral factors, there are lifestyle factors. But we also know that there are systemic factors that also impact these outcomes that we see that are disproportionately devastating our community as well. When we think about the healthcare system, it has not always been kind to people of color, to Black people. And we know that racism exists. We know that sexism exists. A host of isms that at times can really impact the health outcomes that individuals experience and that even populations experience. But I would say, even though we may feel as though we have strikes against us when it comes to those various conditions, this is where I encourage individuals to have those difficult conversations with your family members and with your healthcare provider. This is really where family health history can be immensely helpful and empowering in helping you to manage your risk for those various conditions. And again, by sharing that information with your healthcare provider, it may increase your access or enable access to more precise and tailored treatment to help you manage your risk for those particular conditions.
Okay. We have another guest who's mentioning about their mom passing away in January, and you have our condolences. Sorry for your loss. And I didn't know she had congestive heart failure. So I'm really digging in to find out what may impact my future and my children's future.
Yes, I am truly sorry to hear about your recent loss. And you are doing one thing that will help to empower you as well as your children by really trying to better understand your mom's health history. So if you are able to access her health records and really delve into those records to find out when was she diagnosed with various conditions, what were the treatment options that were available to her, and even getting an idea of what her various lab results were. That could be very helpful in managing your risk for congestive heart failure, but also for other conditions as well. And as you learn this information, try to keep great records of it and also share that information with your children in the event that you are eligible for testing in the future.
Thank you. Are there ways that we can safeguard our genetic information for potential misuse?
So this really makes me think of a multitude of safeguards that the All of Us research program has really implemented around data privacy.
Mhm.
The All of Us research program has taken several steps really to ensure that research participants' data is safe. And some of those steps include removing individuals' names from records before that information is available to researchers. Also, the All of Us research program has gone through the appropriate steps to get a certificate of confidentiality, again, as a way of protecting the data that it has collected from various research participants. Also, individuals are encouraged to log into your portal, be very familiar with your consent forms that are available. And if at any time someone is uncomfortable proceeding in whether it's the All of Us research program or any type of research study, you always have the autonomy or the agency to remove yourself from that study and to ask that your data be destroyed. So that is an option that is available to individuals in the event that they get to a point where that they are uncomfortable proceeding. But at the same time, individuals are definitely encouraged to check out that All of Us website, the Join All of Us research program, just to learn about the various privacy protections that are in place. And all of us knew that this would be a topic of concern, especially as it sought to recruit a diverse cohort of participants. So it was definitely something that it prioritized in making sure that it did the right way in order to retain and recruit individuals into the study.
Thank you. I know that's a concern always, especially with these breaches. Just want to make sure that our information is protected. So thank you for answering that. Another question that we had is, what familial links have researchers seen between genetics and Alzheimer's or genetics and Parkinson's disease, if any?
Mhm. Yeah, so there are a number of genes that have been previously identified to be associated with increased risk for Alzheimer's disease, such as the ApoE4 gene. And then in terms of Parkinson's disease, there are various panels that are available. And I think one of the genes that comes to mind, I think it's LR. Okay, sometimes I have to write it out. I think there's a gene LRRK2 is one of
Okay.
the genes that I recall off the top of my mind that is associated with Parkinson's disease. But there are several different genes that are associated with Alzheimer's and Parkinson's. And really, the best way to determine if you are a candidate for that type of testing would be to talk about your personal health history and your family health history with your healthcare provider or a genetic counselor. And then that healthcare provider can help you determine if you're a candidate for testing and then the appropriate test to pursue. And that could be a test that includes multiple genes, or it might be what we call a targeted test. For instance, if you know that there is a gene variant in your family that has been passed down from generation to generation that's associated with Alzheimer's or Parkinson's, your genetic
Mhm.
counselor or healthcare provider can order that specific and targeted test as opposed to ordering a broad panel. So that's where, again, it's important to have that conversation about family health history and personal health history.
Okay, that leads us to our last question of the evening as we are coming to the top of the end of the hour. What is the best way to create a medical history log?
Yeah. So again, when recording your family health history as well as your personal health history, but with family health history in particular, at a minimum, try to go back at least 3 generations at a minimum, and try to collect information on both sides of the family if possible, if available, and try to keep that information documented and stored in a safe and secure space, but also share that information with relatives. So while you may collect that information, there might be other family members who are also able to record and store that information, just to increase the risk of it, or to increase the chances of it being passed on and shared with other family members. Years ago, the U.S. Surgeon General, Dr. Regina Benjamin, actually had an initiative called the Family Health History Initiative. And I believe that that website is still active. And that's a website where individuals can go and actually start recording their family health history information and get a list of like the types of questions that you can ask, as well as the different types of ways that you can record that information. So those are just a few suggestions and recommendations that I would provide around collection of family health history information.
Wonderful. Is it okay? Can you put the QR code back up again? Are you able to put
Yes.
that QR code back up one more time? So as we exit for the evening, and as we want to say thank you so much, Dr. Ewing, for this invaluable, I should say, presentation and this information. We know that knowing your genetic ancestry is crucially important. And then the more that we know, the more that drugs can be tailored to people that look like us, the people who are affected, that are sometimes that we're overlooked. And a lot of times that the products are just not made for us because we're not a part. And so this is an opportunity in a way for us to be a part of this community. The Altovise project, they are trying to enroll 1 million people in their project. They have over 700,000 currently who are enrolled in the Altovise research project, but this is a project where they're just looking for adding diversity and just enrolling diverse candidates like those on the line. So we would like to say again, thank you, Dr. Ewing. We want to say thank you, Mochas, for spending time with us this evening. And thank you to our Mocha Mom supporters who also joined us for this evening. This is your last opportunity to go ahead and take a picture and grab this QR code, but we will also send this out to all the participants as well. So thank you and have a good evening.